Hello and welcome. I'm Sandra from the Viscosol LLC. I'm the member. And hello, Claudio. You are the director of the Viscosol LLC and asked me to make a video statement with you. As a lawyer, you are connected to Germany, your second home as an American entrepreneur with Italian roots. Your parents were immigrants themselves and founded a home in Germany. Is this right?
Yes, that's right. Uh, uh, First of all, thank you very much to be here, Sandra, and to make this movie together with me. Thank you very much. And yes, I am managing director of the Viscosol LLC. But dear Sandra, you are also a member of the Viscosol LLC.
Yes,
So
that's
we
right.
are together entrepreneurs, and we took decision to make this video, and it will deal with the
Mhm.
statement of Robert F. Kennedy.
Mhm. Um, your parents lives were taken by medical malpractice during the pandemic. So then you have been committed to solving the murders of your parents.
That's true. During the lockdown, during the pandemic time, how we called it, my parents were yes in hospital, were taken in hospital, and yes, they made a lot of mistakes, a lot of maltreatment, medical maltreatment, and we also have the medical documentation. We asked for them, so we have also the medical uh, the medical documents in hand, which proves all these medical maltreatments.
Mhm. So today we want to discuss the letter received by the German Ministry of Health from Viscosol LC.
Yes, yes,
Mhm.
Sandra. We took decision to make a petition to the German Parliament, Deutscher Bundestag, because we heard about it on the media. We heard about the statement of Robert F. Kennedy, who criticized the German government
Mhm.
for mistreating, for the sanctions against against doctors who uh, stands for their values, and so we took a decision to write it.
Mhm. This is a letter from a Ministry of Health. So you see it, we get it.
At first, maybe we will start with the petition
Yeah.
which I wrote. I would like to. I want to read it so you can easier understand it.
Yeah.
Dear ladies and gentlemen, we would like to address the important and correct public speech by U.S. Secretary of Health Robert F. Kennedy from January 10th, 2026, and demand a statement and remedy from the Federal Ministry of Health, Nina, Miss Nina Wag. In this public address on January 10th, U.S. Health Secretary Robert F. Kennedy accused the German government to disregarding patient autonomy. Among other things, he stated that more than 1,000 German doctors and their patients are facing criminal charges for granting exemptions from masks, mandates, and injections during the COVID-19 pandemic. According to Kennedy, this action by the German government undermined patient autonomy and restricted individuals' ability to make informed medical decisions based on their own convictions. The Federal Minister of Health, Nina Warken, countered that at no point during the pandemic were doctors obligated to administer vaccinations, injections against COVID-19. She further started that anyone who, for medical, ethical, or personal reasons, did not wish to offer a vaccination had neither committed a crime nor faced any sanctions, criminal prosecution, had occurred exclusively in cases of fraud and forgery, such as the issuance of false vaccination certificates or counterfeit mask exemption certificates. When the Federal Minister of Health, Nina Warken, publicly claims that there was never an obligation for doctors to administer COVID-19 vaccinations, this contradicts reality and the facts publicly available uh, in the web database. Who else would have been responsible for administering the injection or vaccination other than the doctors themselves and medical assistants on the doctor's orders? In addition, dentists, veterinarians, and pharmacists were allowed for a time to administer the vaccination or injection to those affected. The fact is that according to current case law, doctors and the aforementioned professional groups acted in the exercise of a public office entrusted to them when administering the COVID-19 injections or vaccination. Therefore, the doctors and the aforementioned professional groups acted as administrative assistants in the performance of a sovereign task, so-called public officials. See the Federal Court of Justice, BGH, ruling of October 9th, 2025. According to this ruling, the doctors acted in the exercise of a public office entrusted to them when administering the C injection, the so-called vaccination. Therefore, in the case of the injection, the doctor acted as administrative assistants in the performance of a sovereign task. According to the ruling of the Federal Court of Justice, it is conceded that the so-called right to vaccination has a close connection to interventionist administration, since the refusal of a so-called protective vaccination would have been associated with adverse consequences for the person concerned, such as in the form of a fine-backed access and contact restriction, the fine-backed requirement of proof of a test for entering the workplace, or the imposition of a ban on entering or working in certain facilities and companies. Consequently, the so-called right to vaccination amounted to a compulsory injection or vaccination, meaning that people could not decide freely, but were subject to the aforementioned sanctions if someone decided against the injection or vaccination. For it cannot matter how the sovereign measure of the interventionist administration is described, such as a right to vaccination, but rather only the decisive factor is the impact on those affected if they do not exercise the so-called right to vaccination and decide against the injection or vaccination. The fact is that the right to self-determination over one's own body and life has been interfered with by direct or indirect administrative action, as those affected would have faced discrimination and sanctions. Furthermore, it should be noted that the German Bundestag passed a law mandating vaccinations within specific institutions. This mandate applied particularly to employees in facilities with vulnerable individuals, such as nursing homes and hospitals. Those who refused to receive the injection or vaccination face disciplinary actions. The same applies to companies in general where services were provided that required a human presence or human to human contact. We would like to emphasize once again that from a legal perspective, every medical procedure is subject to the duty to inform and the requirement for the patient's consent. The same applies to scientific experiments. Under no circumstances may the duty to inform and the patient's right to consent be waived. Consent to a medical procedure must be freely given, without deception, coercion, threats, or fear and panic on the part of the person concerned. Since a mandatory vaccination policy for healthcare facilities has been introduced by law and moreover sanction mechanism have been implemented, it cannot be said that this was a free decision on the part of the individuals. Furthermore, a medical procedure, namely injection or vaccination, has been politicized. It is not permissible for politicians to interfere generally and abstractly with the right to self-determination over one's own life and body, as has happened here. This also applies to other COVID-19 measures, such as mandatory social distancing, mandatory mask wearing, mandatory PCR testing, mandatory isolation, and forcing those in need to expose themselves to medical malpractice. We demand an admission of guilt as well as an investigation and reckoning with the excesses that occurred during the COVID-19 pandemic due to the inhuman and dehumanizing COVID-19 measures. People who resisted the COVID-19 measures by refusing to comply must not be further criminalized. Doctors and others who protected people from the inhuman COVID-19 measures must not be subjected to criminal prosecution. There must be no political suspicion directed at these individuals. There must be no political suspicion directed at these individuals. We also take this opportunity to draw attention to the situation of Dr. Füllmich and demand his release. Furthermore, we demand that those primarily responsible for the conceiving and implementing this political narrative be held accountable and that compensation be provided must be provided to the victims. Liability must be assumed where the decisions were made and not at the smallest link in the chain that had no influence whatsoever on the decision. We cannot and must not continue to tolerate this kind of policy of absolute absolving of responsibility, because by its very nature, decision and liability are inextricably linked. We demand a statement and a remedy from the Federal Ministry of Health, represented by Federal Minister Nina Warken. And yes, and that's the end of the letter of the petition. And now, after one day, uh, we we did not expect so soon. We received an answer from the Ministry of Health,
Mhm.
and Sandra will now read the response.
Mhm. Thank you to Nina Warken uh, for this letter. Dear Mrs. Sauer, dear Mr. Walbo, thank you for your messages dated January 12, 2026, in which you refer to statements made by the US Secretary of Health, Robert F. Kennedy Jr., that they are politically motivated proceedings against doctors and patients in Germany. We are happy to respond as follows. First, we would like to point out that the statements made by Robert F. Kennedy Jr. are completely unfounded. There are no politically motivated proceedings against doctors or patients in Germany. The statements made by the US Secretary of Health are completely unfounded, factually incorrect, and should be rejected. In Germany, constitutionally protected medical freedom of therapy applies as a matter of principle. Doctors decide independently and on their own responsibility of the treatment of patients. The scope of services covered by statutory health insurances is based by proven scientific evidence and is not terminated by politics. Likewise, patients are free to decide which therapy they wish to receive. During the coronavirus pandemic, there was never any obligation for doctors to administer COVID-19 vaccinations. Those who did not want to offer vaccinations for medical, ethical, or personal reasons, we are not liable to prosecution, nor did they have to fear sanctions. There was no professional ban or fine for not vaccination. The only requirement was that doctors had to be able to provide a vaccination certificate for those who had been vaccinated. Criminal prosecution was only pursued in cases of fraud and document forgery, such as the insurances of false vaccination certificates or fake mask certificates. Best regards from the Referat L9
of the Health Ministry
of
of
the,
Federal Republic of Germany.
yes,
Thank you very much, Sandra. Yes, we wanted to read it, so you can understand better about the issue. And yes, we made this petition, and yes, we get also an answer because uh, because the statement of the federal of the German Health Ministry, the German Health Ministry was not right. It was not true. It was
yes,
not true because there was an obligation. There was an obligation. So let's see again. This obligation was particularly for the health nurses, for personnel in the health system who worked. And Sandra had also her experience
yes.
in this field because she refused. She refused to make this vaccination. We call it always vaccination, but on my point of view, it's not the right word to describe this kind of measure. In my point of view, it deals with an injection, and it was not a vaccination.
No, it was a bioweapon.
It was a bioweapon, and it was also a tool of sanction, a tool of yes, which was connected to many objectives, which I don't want to talk now here, because it's too large now to talk about this. But Sandra can tell us her experience during the pandemic time.
In this time, I lost two jobs in the hospital because I didn't want to make a PCR test, and I don't want wear a mask the whole day. So that was the background. So I lost the jobs, and later I was get out with five policemen out of my house. They don't want me in this town.
Um, to explain, during pandemic time, it was forbidden. It
Yes.
was forbidden to make to take such measures, and but they did it. They did it despite of this rule. So Sandra was took out by five policemen,
Yes.
armed policemen. And so we have finally a witness. Sandra is a witness
Yes.
of this time, and no, it was coercion. It was coercion, and it was against the right of self determination about its the own body, about the own life.
Hmm.
And no, it's not truth. It's not the truth what the Minister of Health of Germany said. And in despite of the response, they insisted on their position. We on the response we can see it
Mm.
that the Ministry of Health insisted.
Mm.
and continues to reject finally also the statement of the Health Ministry of the United States.
Yes. In my background, Karl Lauterbach is coming from the town Düren, and the mayor of a circle of Düren is Wolfgang Spelthan, and they are um, from the same party, the political party, and so there was an impact with a lot of Chinese title from immigrants. So there are a lot of problems, and so it was for me not possible to break out in this time, to get out, and was a very, very hard time for me.
Yes, we have the scandal in Germany there regarding immigrants, illegal immigrants,
Chinese
which
and
came
Arabian.
from China, especially from China. And yes, it was a very tough time for Sandra and to yes to make her profession. But finally, she took decision to refuse and to take the consequences and to take the measures, the sanctions, the coercion which was used against her. And Sandra is not the only person.
Yes.
Many else of nurses, doctors, of clinical personnel
Yes.
had also to take the consequences of refusing uh, the measures. The measures, especially the injection or vaccination, so-called injection. Yeah. So, what we want to tell, what should we tell more? Um, Finally, we took also a decision by court, by the civil court of Germany, the highest civil court of Germany, the BGH. The court conceded that these measures, especially the injection or so-called vaccination, had uh, an implication of intervention on on the right of self-determination about the own body and the own life. So we have also from part of the case law uh, that they concede that there was coercion. Finally, it was a coercion and against the will. It was not freely,
No.
like Miss Warken said. No, it was a sanction. It was coercion, and it was not freely. And if yes, if the persons can't decide freely, it's an intervention of the natural right of self-determination. Yeah. And yes, do you want to add something, Sandra? Do you want to add something to our petition and to the response which we get?
Mm. I hope Nina Warken will read it
Mhm.
personally, and I hope she understand what we will say. We are not against Nina Warken
Mhm.
because she is
Heritage.
yeah,
She gets a heritage from Mr. Lauterbach.
yes,
He
and
was
Jens Spahn.
yes.
So the the mistake is made by Jens Spahn and his mask deals and other treaties. So I want to make that the truth will come
out. Will come
yeah.
out. Yes, and yes, I want also to add what you said, Sandra. It's very important that the persons who take responsibility, who take the decision, the persons who take the decision about these measures, has to take also the responsibility and the liability. It cannot be that the responsibility that there is no responsibility for the decisions which were taken. So it is important to clarify this situation and also to bring consequences on what was happened, especially for the victims,
Yes.
because we have victims of these measures.
Yes. Jens Spahn is best friend from Müller. He was the CEO from Dr. Morris. So it is a very big pharmaceutical company. And so there are many lines together. Um, these lines are going back to Düren, to another company owner. So it's very important to change the lie to make in truth.
That means there are relationships. There are
Yes.
relationships between different persons
Yeah.
who are in who are in special positions and who takes also this important decisions. So we have also to see these networks, to understand these networks,
Yes.
how they work. Yeah, and yes, we ask for a clarification. We ask yes to verify all this issue, because it must not repeat again. On our view, it must not repeat again. We understand economy, it's always changing. Economy is not always the same. It's changing, but we have to change economy together with the human beings, with the persons, but not against the human
Yes.
beings and persons. And
Yes.
that's very important to understand. And so we hope that yes, that there will be consequences for a better way to handle this kind of economic and political decisions in future. Sandra, thank you very much to
Thank
be
you.
here and to talk with me. And yes, we wish you a good evening, and we will see you next time.
Yes.
Bye bye.
Bye bye.